I qualify it like this is a marker of fraud. It's an act of deception. It looks, it's a device intended to deceive the user of the data.
What she has hidden from the public has prevented us from giving informed consent. Not studying these people, not studying these injuries, um, is unacceptable, unethical, and abhorrent, because it is by learning about the people who were hurt that we can prevent other people from being hurt.
Liar, liar, pants on fire. That's what the findings of a Freedom of Information request appears to reveal about British Columbia's Public Health Officer, Dr. Bonnie Henry, the BCCDC, and their efforts to cover up how dangerous the COVID jabs they've been pushing on all of us really are. Let's talk about it.
Hey Canada, I'm Dr. Bonnie Henry. I got vaccinated because it's the best thing to do to protect yourself, the people you love, and our whole community. I want you to join This Is Our Shot Challenge and tag your family and friends to get vaccinated too. Let's all get the shot.
Drea Humphrey here with Rebel News. And do you think that if Canadians were told that COVID-19 jabs were 16 times more dangerous than the flu shot, they would have taken them? That's a consideration that citizens were never granted, even though newly released Freedom of Information documents expose that British Columbia's Centre of Disease Control, which works hand in hand with the Public Health Officer Dr. Bonnie Henry, not only knew this was the case, but manipulated data to report otherwise to the public. It's shocking. Immunologist, vaccinologist, and unsung hero Dr. Byron Bridle released a damning summary on his Substack of a report he obtained via an FOI response given to a BC lawyer named Lee Turner, who has been representing healthcare workers that have been victims to COVID tyranny. The 1,315-page report includes insider information and email conversations about the province's tracking of adverse events following immunizations for both COVID-19 and the flu shot. And despite Dr. Bonnie Henry telling the public this,
Also, I'm confident that all of our vaccines that we are using in our program here in BC and in Canada are being monitored carefully, and the safety signal that we saw and what we've seen now with this person being our first case here in BC tells us that our safety monitoring system is working, and we will continue to provide you information as it becomes available.
this report tells a different story. In his summary, Bridle lays out proof, which I verified via the documents, that shows the BCCDC discovered COVID-19 shots were more than 16 times more dangerous than the flu shots, but never disclosed this to the public. The chart shows the accumulated adverse events data that the BCCDC had for COVID jabs between December 20th, 2020 and March 25th, 2021, along with a comparison of that to adverse events that historically occurred with the flu vaccine. On the first columns, highlighted in blue, you see that an cumulative total of 523 adverse events occurred, which according to the row for flu vaccines is a 13-fold increase to what our historic flu vaccines cause. When it came to serious adverse reactions, like Tenley, the 22-year-old healthcare worker who lost the use of her legs after taking a Moderna shot, or Sean, who lost 2 meters of his intestine for taking AstraZeneca, we see there were at least 144 such reactions. And when it comes to hospitalizations and deaths, the BCCDC data shows that COVID jabs had 16 hospitalizations during that period, which was a 13.6 times more than the flu shots, and a total of 3 deaths, which, small in number, still equals 24 times more than what we historically see with the flu shot. Instead, a couple of weeks later, we see an email from BCCDC communicable disease epidemiologist Kyle Nofdahl. It's addressed to the agency's communications officer, Heather Amos, and medical director of immunization programs, Dr. Monica Naus, whose role includes strategizing with Dr. Henry on vaccination policies and programs. And right here in black and white, we see they are strategizing on how to manipulate the COVID-19 jab data that every citizen deserves to know. Noftel says he's attached the final version and very first version of the adverse events report for the public and admits that the COVID-19 section of it is being reworked. He also mentions that Monica was going to send some more on how to message things as well. So what did the team of vaccine pushers come up with then? This. A report that claims to summarize the COVID jab adverse events that occurred during the period of time we discussed in those charts earlier, plus an additional 2.5 weeks to get them up to the date of this email. And they appear to flat out lie here in saying serious events have not been reported at rates higher than expected compared to background rates. I'm sorry, what? What better background rate could they have had other than the standard flu shot, which at this point they now know is safer than the COVID jabs, but aren't telling anybody? And look what they do next. Instead of just releasing to the public the charts that they had already shared amongst themselves, the public was given this chart instead, with no mention of historical flu adverse events for comparison, but there is mention of another lie. Remember, you saw that they knew that between December 2020 and March 25th, 2021, they had 144 serious adverse events. Well, despite tacking on an extra few weeks for this now new period they're covering, which, by the way, had more adverse events, they reworked the numbers to fool the public into thinking that they actually only had 26 serious events. 26. What happened to the other 118? I reached out to chartered financial analyst Lex Acker, whose expertise is identifying red flags that could indicate fraud in financial reports, after I saw a comment he made to Liberty Talk podcaster Odessa Orlitz, who, unlike the mainstream media, is also trying to shed light on this apparent vaccine injury cover-up. Here's what Acker had to say when he looked into the missing 118.
What I noticed is on March 25th, 2021, they use a particular definition for an adverse effect. And then starting on April 3rd, 2021, they changed the definition of an adverse effect following immunization. And that new definition is much more narrow. And that explains why there's a sudden drop in reported adverse effect following immunization starting on April 3rd. 2021, and this is the time when the BCCDC started putting out public information on that topic. They needed to have a number that's much more acceptable to the public. Now, changing the definition of a measured quantity without telling the user of that data, this is a very deceitful behavior, and I've seen that a lot in the financial statements of publicly listed companies. And when I see that kind of behavior, I qualify it like this is a marker of fraud. It's an act of deception. It looks, it's a device intended to deceive the user of the data.
Now we're talking about real injuries of who really knows how many people being covered up to continue the rollout of an experimental jab that was far from the safe and effective jab that we were sold. Bonnie Henry must be laughing all the way to the bank in her $400 Fluvog shoes and her $300,000 tax-paid-for salary, all the while telling you to be kind, be calm, be safe, and be vaccinated, or else. I reached out to Stephanie Shigar, a BC mental health clinician who says she nearly died after taking a Moderna jab, to get her response to finding out 3 years later that it appears public health authorities withheld vital vaccine safety data from her and millions of others.
Within an hour, my hands became numb and useless, and I started having the worst headache of my life. The inflammation all over my body was unbearable. The pain, the confusion was the worst I've ever had in my life. My entire body reacted negatively. I ran into walls. I fell to the floor. I lost my bowels. I developed severe neuropsychiatric symptoms. My heartbeat went at 160 beats to 130 beats for months at a time. And I was refused medical care. I was told that the vaccine had nothing to do with it. I suffered a severe, immediate neurological emergency. Today reading about the report that Dr. Bridle nicely explained. I feel a level of vindication because I knew just how much dishonesty there had been and how the lack of transparency on the part of Bonnie Henry has affected citizens of this province. What she has hidden from the public has prevented us from giving informed consent. Not studying these people, not studying these injuries is unacceptable, unethical, and abhorrent, because it is by learning about the people who were hurt that we can prevent other people from being hurt. And so I hope that the public is appalled. I hope that the public demand justice. As for myself, I still cannot return to my career in public health care because I am still required a second vaccine, which I will not take for fear of losing my life this time. This is the greatest injustice of my life, and some people need to be held accountable for this.
Since COVID-19 jabs were coercively rolled out to Canadians, Canadians are only getting sicker. Excess deaths are at an all-time high, heart attacks are on the rise, and autoimmune disease are soaring. And while I certainly can't say that correlation is caused by the COVID jabs, I think it's clear to say that Dr. Bonnie Henry is likely to be the last person to tell you if it was. Drea Humphrey for Rebel News. At Rebel News, we've been telling you the other side of the politically correct story to COVID-19 since January 2020. If you appreciate the work that we bring you that's completely independent of government interests, consider supporting us in a very fun way just in time for Canada Day by doing your shopping at rebelnewsstore.com and buying 2 unisex t-shirts and getting the third free.